What if I told you that the progressive recession of your gums is more than just a cosmetic problem? It's a subtle warning flag that could impact your heart, brain, and even your vitality around age 60. Most older people are informed that once their gums start to recede, they can't go back. But new studies from places like Harvard Medical School show that your gum tissue is much more responsive than you thought. The actual question is this: are you doing things every morning that you don't know are making your gums worse? Or may a few simple modifications start protecting and perhaps helping your gums heal starting tonight? If you want to know about senior health recommendations, how to live a healthy life as a senior, and proven anti-aging routines for people over 60, please subscribe now. We explain science-backed tips in simple terms on this channel, so you may keep your independence, your smile, and your energy after 60. If you ignore these tips, you can miss out on habits that will keep you healthy for a long time. And today's topic, gum renewal, can be one of the most important yet least talked about parts of being healthy all over. Let's start with the first secret that most dentists don't talk about much. It starts with something you do every morning. The hidden inflammation that's making your gums smaller. Expanded deep dive. What if I told you that gum recession doesn't really start at the surface where you see it? It starts deep beneath the gum line, where inflammation quietly weakens the fibers that hold your teeth in place. Most seniors only notice gum loss after their teeth look longer or they start to feel sensitive. But by that time, the biological damage has already been going on for a long time. And here's the scary part. If inflammation isn't treated, it doesn't just shrink your gums, it also increases systemic inflammatory burden, which Harvard Medical School has linked to higher risks of cardiovascular disease and cognitive decline. So the real question is, are your gums trying to warn you about something bigger happening inside your body? Let's break down what's really going on at the cellular level, because knowing this changes everything. Your gums are held to your teeth by special collagen fibers called periodontal ligaments. These fibers act like tiny suspension cables. When harmful bacteria build up along the gum line, your immune system releases inflammatory chemicals like interleukin-1 and tumor necrosis factor. The Mayo Clinic says that these inflammatory mediators don't just attack bacteria, they also start to break down collagen and connective tissue. Think of termites inside wooden beams. From the outside, everything looks stable. Inside, the structure is slowly weakening. If you've noticed bleeding when brushing, mild swelling, or persistent bad breath, those are not minor annoyances, they are biological alarms. Take a moment to think about this. When was the last time your gums bled a little and you didn't do anything about it because you thought that just happens after 60? That idea is one of the biggest myths about oral health in seniors. Bleeding is not normal aging, it is active inflammation. If you ignore it, it could hurt your health in ways that go beyond your smile. A 2023 review of periodontal health found that adults over 60 have a stronger inflammatory response because of changes in their immune systems that come with aging. This means that once gum inflammation starts, it can get worse faster than it did in your 40s or 50s. That's why senior health tips must include proactive inflammation control. Healthy living for seniors isn't just about heart and joint health. Your gums are part of the same inflammatory network. The bloodstream doesn't separate your mouth from the rest of your body, so bacteria and inflammatory markers can get into circulation and increase systemic stress. Now ask yourself, if your gums are inflamed every day, what might that mean for your arteries? This is where hope comes in, and it's very important. Early-stage gum recession caused mostly by inflammation can stabilize and even partially reverse at the attachment level when inflammation is aggressively reduced. Studies show that when plaque levels are consistently lowered and inflammatory load decreases, gum tissues can reattach microscopically and tighten around teeth. This does not mean dramatic regrowth overnight. It means stabilization, thickening of tissue, and prevention of further detachment. That distinction is powerful
because stabilization alone can preserve your teeth for decades. So how do we break the cycle of inflammation? First, we need to consistently and precisely disrupt the bacteria. Research from the American Academy of Periodontology shows that biofilm, the sticky layer of bacteria on teeth, reforms within 24 hours. That means that if you skip even one night, the inflammation will start up again. Think about putting out a small fire every day instead of letting the embers burn overnight. Which scenario protects your home? Your gums work the same way. Second, antimicrobial support is important. Rinses made with essential oils have been shown to lower plaque and gingivitis markers by a lot over 6 months. For some people, short-term chlorhexidine therapy can dramatically lower bacterial overgrowth. The key is not to rinse randomly, but to strategically lower harmful bacteria while keeping helpful oral microbes. Using harsh antiseptics too much can throw off the balance, so it's important to use them correctly. This is why I always stress informed, targeted action instead of aggressive guessing. Third, high blood sugar levels make inflammation worse. The American Diabetes Association says that uncontrolled glucose levels greatly increase periodontal destruction. Even in seniors who don't have diabetes, repeated blood sugar spikes from refined carbohydrates fuel bacterial growth and the body's inflammatory response. Imagine feeding the very organisms that are weakening your gum attachment. It's not just about losing weight, it's also about keeping the collagen in your mouth strong. Now picture your gum tissue as living, moving material that can heal itself when the right conditions are present. Feel that shift in perspective. Instead of thinking, my gums are getting smaller because I'm older, think, my gums are responding to inflammation signals, and I can change those signals. Just that shift in thinking can change how well you follow through and how well you do. Chronic stress is another factor that is often overlooked. High cortisol levels lower immune function and raise inflammatory activity. Harvard Health studies have found links between chronic stress and periodontal progression. Seniors who care for spouses, manage finances, or go through major life changes often carry silent stress burdens. Ask yourself quietly, could stress be affecting your gum health? Stress management should be a part of any anti-aging routine for people over 60, because inflammation is not just bacterial, it is biochemical. Now here's the cliffhanger. Even if you get rid of bacteria and brush better, inflammation will continue if you keep hurting your gums. This leads us right into the next section, where we'll talk about how many well-meaning seniors hurt their gum line every day without even realizing it. What you're about to learn about brushing pressure could completely change how you take care of your smile starting tonight.
The way you brush could be causing recession. What if the habit you think is protecting your teeth is actually slowly pushing your gums away from them? This may sound surprising, but according to the American Dental Association and multiple periodontal studies, mechanical trauma from improper brushing is one of the leading non-disease causes of gum recession in adults over 60. And here's what makes this dangerous. It feels productive. It feels clean. It feels responsible. But over time, excessive pressure and incorrect angles create microscopic damage that your aging gum tissue cannot fully recover from. Now pause and ask yourself honestly, when you brush, are you cleaning or are you scrubbing? Let's look at the biology behind this. Your gum tissue isn't meant to handle repeated horizontal force. The epithelium, which is the outer layer of gum tissue, is thin and fragile, especially as we get older. Research shows that as we age, our tissue gets thinner and less dense in collagen, which makes our gums more prone to trauma from friction than they were in their 30s or 40s. When you brush aggressively from side to side, especially with medium or hard bristles, you create small injuries at the gum line. These small injuries may not bleed right away, but over time, they weaken attachment and contribute to recession. Imagine rubbing the same spot on your skin every day with firm pressure. Over time, the skin thins. Now imagine doing that twice a day for decades on tissue that is even more delicate. That is what aggressive brushing does to your gums.
And here's the subtle danger. Recession from trauma often looks clean and pale, not inflamed, so many seniors think it's just aging. But the real problem is mechanical wear. A clinical review published in the Journal of Periodontology found that patients who switched from hard bristle to soft bristle brushes and changed how they brushed their teeth saw measurable decreases in gingival abrasion within weeks. This is not cosmetic advice, it is structural preservation. The gum line is the foundation of tooth stability. When it recedes, tooth sensitivity increases, root surfaces become exposed, and long-term tooth retention is threatened. Ignoring this could silently accelerate tooth mobility in later years. Now let's talk about pressure, because this is where most people go wrong. A lot of seniors think that brushing harder gets rid of more plaque. But plaque is a soft biofilm that doesn't need force, it needs to be disturbed. Studies have shown that light pressure and the right angle are enough to get rid of plaque. In fact, too much force can flatten bristles, making them less effective at cleaning and hurting the gums more. So the harder you brush, the less effectively you clean, and the more damage you do. Think about that for a moment. Here's how to fix it. Use a toothbrush with soft bristles and hold it at a 45-degree angle toward the gum line. Instead of scrubbing back and forth, use small circles or vibrating motions. This method, which is often called the modified Bass technique, lets the bristles gently enter the sulcus, which is the tiny space between the tooth and gum where bacteria build up. The goal is to be precise, not powerful. Picture yourself brushing tonight with slow, deliberate movements. Feel the control instead of the force. This simple change could make a big difference in stopping further recession. Electric toothbrushes are also worth talking about. According to studies that compare the two, oscillating rotating electric brushes are better at getting rid of plaque and gingivitis than manual brushing when used correctly. But here's the most important thing. Even with electric brushes, pressure matters. Many modern brushes have pressure sensors for a reason. If you see that red light a lot, your gums may already be under stress. Ask yourself, does your toothbrush ever tell you that you're pressing too hard? If so, your gums may be paying the price. Brushing time is another thing that is often missed. The best time to brush is for 2 full minutes. However, brushing for too long with too much pressure can make the trauma worse. It's not about brushing harder or longer, it's about brushing smarter. For seniors to live a healthy life, they need to keep their tissue healthy, not wear it down by overcorrecting. Now let's talk about gum stimulation, which is where a lot of people get confused. Gentle stimulation increases circulation and can make tissues stronger, but stimulation is not the same as abrasion. Think of it like exercise. Moderate activity makes muscles stronger, but too much activity hurts them. Your gums work the same way. Controlled stimulation improves blood flow, which brings oxygen and nutrients needed for maintenance and repair, but repeated friction tears down protective layers. And here's something that doesn't get talked about much. A lot of seniors brush their teeth right after eating or drinking acidic foods or drinks, like citrus, coffee, or vinegar-based dressings. Acid temporarily softens enamel and makes gum tissue more vulnerable. Brushing during this time increases the risk of abrasion. Dental experts say you should wait at least 30 minutes after eating or drinking acidic foods or drinks before brushing. Instead, rinse your mouth with water first. Think of how many times this small timing mistake may have led to gradual gum line wear over the years. Now I want you to think hard. If your teeth look longer than they did 10 years ago, if your roots are sensitive to cold, or if your dentist has talked about abrasion at the cervical margin, your brushing habits might be to blame. This isn't about guilt, it's about empowerment. Anti-aging routines for people over 60 include changing habits as biology changes. What worked at 35 might not protect you at 65. The most important thing to remember is that you can stop gum recession caused by trauma by fixing the mechanical stress. When trauma stops, inflammation goes down. When inflammation goes down, stabilization becomes possible. And stabilization is the key to keeping your natural teeth for life. Just think, you could keep your own teeth into your 80s and 90s if you changed the way you brush your teeth today. But we're not done yet. Even if you brush perfectly, your gums can't stay strong without the right support from inside. In the next section, we'll talk about the nutrient deficiencies that quietly stop gum repair. These deficiencies are surprisingly common in adults over 60 and have a direct effect on collagen production and tissue strength.
The nutrient deficiencies that stop gum repair. What if your gums aren't failing because of your toothbrush, but because your body doesn't have the raw materials to rebuild them? Most people only think about plaque and how to brush their teeth, but very few people know that gum tissue is living connective tissue that needs the right nutrients to stay thick, strong, and attached. And here's the uncomfortable truth. After age 60, nutrient absorption decreases. Appetite patterns change, and subtle deficiencies become much more common than most seniors realize. According to Harvard Health Publishing, even small micronutrient deficiencies can stop collagen production, which is the structural backbone of your gums. So let me ask you something important. If your body can't make strong collagen efficiently, how can your gums possibly stay firm and attached? Let's start with vitamin C. This isn't just a historical footnote about scurvy, it's a real problem for older adults today. Vitamin C is necessary for making collagen. Without enough vitamin C, collagen fibers become weak and disorganized. The Mayo Clinic says that early vitamin C deficiency can show up as bleeding gums long before severe deficiency symptoms appear. This means that mild gum bleeding may not only mean plaque, it may also mean that tissue repair is not working properly. A 2022 review of older adults found that those who ate more vitamin C had better periodontal stability than those who ate less. Now think about this. When was the last time you intentionally checked how much vitamin C you are getting each day? Do you still eat citrus, bell peppers, strawberries, or leafy greens? Or has your diet slowly narrowed over time? But vitamin C can't do its job alone. It also needs enough protein to make collagen. This is where many seniors unknowingly fall short. As their appetite decreases or their dietary restrictions increase, their protein intake often drops below optimal levels. Research shows that adults over 60 need slightly more protein per kilogram of body weight than younger adults to keep muscle and connective tissue healthy. Your gums are connective tissue. Imagine trying to fix a fraying rope without new fibers. Without amino acids from protein, your body can't keep gum density. Seniors need enough high-quality protein like eggs, fish, legumes, and lean meats, not just for muscle strength, but also for oral tissue resilience. Now let's talk about zinc, a mineral that isn't talked about much in dental circles, but is very important for healing wounds and controlling the immune system. A lack of zinc makes it harder for tissues to heal and makes you more likely to get an infection. Clinical studies show that zinc helps epithelial cells grow back and controls the body's inflammatory response. Seniors who don't get enough zinc may have slower gum healing after even minor irritation. Ask yourself quietly, do you regularly eat foods high in zinc, like pumpkin seeds, seafood, nuts, or whole grains? Or could you be recovering more slowly without realizing it? Vitamin D is another important nutrient for gum health. The American Journal of Clinical Nutrition has talked about how vitamin D can help the immune system and bone health, both of which are important for periodontal support. Older adults often have low levels of vitamin D, especially in places where there isn't much sunlight. Vitamin D helps the body absorb calcium and strengthens the alveolar bone that holds your teeth in place. When bone density decreases, gum attachment becomes more fragile. This is why vitamin D is often recommended for fracture prevention in older adults. The same idea applies to your mouth. Picture your teeth being supported by strong bone and resilient tissue. Now imagine that support slowly disappearing over the years because of a lack of vitamin D. Which scenario would you prefer to avoid today? And then there are omega-3 fatty acids, which are strong anti-inflammatory compounds that research from Harvard Medical School has linked to less inflammation in the gums. Omega-3s help control inflammatory signaling pathways. If you eat fatty fish like salmon or take supplements under medical supervision, they may help reduce gum bleeding and pocket depth over time. Think about that. Inflammation is the main cause of recession. If omega-3s lower inflammation throughout the body, could they also protect your gums?
The evidence suggests yes. Now this is where it gets even more important. Keeping your blood sugar levels stable directly affects the health of your gums. Even if you don't have diabetes, repeated spikes in blood sugar levels increase inflammatory cytokines and feed harmful oral bacteria. The American Diabetes Association says that high glucose levels make periodontal destruction worse. It's like pouring gas on a small fire every time you eat refined carbohydrates. Over months and years, that repeated spike damages collagen and slows repair. Seniors who eat balanced breakfasts with protein and fiber may be quietly protecting their gums more than they ever knew. Let me ask you to picture something powerful. Imagine two people who are 70 years old. One eats a lot of protein, vitamin C, zinc, vitamin D, and omega-3s. The other eats mostly processed vegetables, little protein, and a lot of refined snacks. 10 years later, whose gum tissue is more likely to stay firm and attached? Nutrition doesn't make things grow back overnight, but it does create the right biological environment for stabilization and repair. And stabilization is everything when it comes to keeping your natural teeth. Here's the important but subtle point that most people miss. Brushing and flossing remove the outside threat, while nutrition strengthens the inside defense. You need both. If you ignore one, the whole system becomes weaker. Anti-aging routines for people over 60 aren't just about individual habits, it's about synergy. When diet, brushing technique, circulation, and inflammation control all work together, gum tissue has a chance to regain its thickness and attachment stability. Now I want you to stop and think deeply. Did your meals last week always include colorful vegetables, enough protein, and healthy fats that fight inflammation? Or has convenience and habit slowly made your diet less varied, which your body needs? This isn't about being perfect, it's about being aware. Small, consistent changes can have a big impact on long-term outcomes. And here's the cliffhanger that connects this part to the next. Even if you get the right nutrients and stop brushing too hard, your gums won't heal properly without the right blood flow bringing those nutrients to the tissue. Circulation is the link between what you eat and what your gums can actually use. In the next section, we'll reveal the circulation secret that most seniors miss and how a simple daily habit could greatly improve gum stability and overall energy after 60.
The secret to good circulation that keeps your gums healthy. What if your toothbrush isn't the real reason your gums aren't healing? What if it's not even your diet? What if it's your circulation? Most people don't think about how blood flow affects gum health, but your gum tissue is living, vascular tissue that needs oxygen and nutrients to stay thick, fight bacteria, and fix tiny damage. And here's the truth: circulation naturally slows down after age 60. The American Heart Association says that as you get older, your blood vessels become less flexible and your peripheral blood flow slows down. Now think about this carefully. If nutrients can't get to your gum tissue quickly, how can repair possibly happen? You can use the best soil and pull weeds from your gums every day, but if water flow is limited, the plants will weaken. The same is true for your body. Less circulation means less oxygenation, a slower immune response, and a delay in collagen repair. Harvard Medical School has said that the health of your blood vessels directly affects the healing of tissues all over your body, including your mouth. So here's a question to think about. How active is your daily routine? Are you giving your vascular system the stimulation it needs to nourish every tissue, including your gums? Moderate physical activity has been shown to greatly lower systemic inflammation and improve vascular function. A 2023 review of exercise and periodontal health found that people who did moderate exercise on a regular basis had lower levels of gum inflammation than people who didn't. This isn't a coincidence. Exercise increases nitric oxide production, which opens up blood vessels. Better dilation means better delivery of nutrients. Imagine going for a brisk 30-minute walk and improving not only your heart health and energy after 60, but also the microscopic healing ability of your gums. Stop and think about your morning routine. Do you wake up, sit down with coffee, stay seated for long periods of time, and put off moving until later? Many seniors unintentionally become sedentary, especially after they retire. But the way seniors start their day can have a big effect on their vascular tone for the rest of the day.
Even gentle stretching, light resistance exercises, or a short walk outside can get your blood flowing again in minutes. You can feel that change. Your hands get warm and your breathing gets a little faster. That same boost in circulation reaches your gum tissue. Another thing that is often missed is hydration. Blood volume depends on getting enough fluids. Mild dehydration, which is common in older adults because they don't feel thirsty as much, can make blood thicker and slow down microcirculation. The Mayo Clinic says that seniors often don't drink enough fluids every day. Think of your bloodstream as a delivery highway. When traffic slows down because of dehydration, nutrient delivery becomes less effective. Could this small habit be affecting the stability of your gums without you even realizing it? Let's go deeper. Fibroblasts are specialized cells that make collagen and extracellular matrix, which are needed for gum repair. Fibroblasts are very sensitive to oxygen levels, and their activity slows down when there's less oxygen. Studies in wound healing science show that oxygen availability is one of the most important factors in tissue regeneration. When circulation gets better, fibroblast function gets better. When fibroblasts work at their best, collagen maintenance gets stronger, and when collagen gets stronger, gum attachment gets stronger. Do you see how all of this is connected? Now think about another layer. Smoking and secondhand smoke greatly reduce blood flow to gum tissue. Even if you quit years ago, your vascular damage may still be there. The American Dental Association says that smokers have much higher rates of periodontal disease progression because their circulation and immune response are weakened. If you used to smoke, it's even more important to improve your vascular health through exercise. The body has an amazing ability to adapt when properly stimulated. Stress also affects your blood vessels. Chronic stress raises cortisol levels and narrows blood vessels. Harvard Health has said that long-term stress can damage endothelial function. This means that emotional stress doesn't just change your mood, it also physically limits circulation. Ask yourself quietly, are you under chronic stress that may be tightening your vascular system every day? For seniors, living a healthy life means managing stress not only for peace of mind, but also for tissue health. Imagine this. You start a regular routine of brisk walking every day, light strength training twice a week, drinking enough water, and doing mindful breathing exercises. Over the course of months, your vascular flexibility improves, inflammation decreases, and nutrient delivery increases. Your gums feel firmer, less tender, and less likely to bleed. This isn't a fantasy, it's physiology responding to stimulus. Anti-aging routines for people over 60 are all about improving circulation and lowering inflammation at the same time. Here's something important to think about. A lot of older people focus on topical oral care, but don't pay attention to systemic habits that affect healing ability. The mouth isn't separate from the rest of the body. It gets blood from the same cardiovascular system that feeds your brain and heart. When you improve circulation, you improve healing ability everywhere. Plus, this approach not only helps gum stability, but also energy after 60, balance, cognitive clarity, and independence. Take a moment to think about it honestly. On a scale of 1 to 10, how would you rate how much you move each day? If the number is lower than you'd like, what small change could you make starting tomorrow morning? 5 minutes of stretching? 10 minutes of walking after meals? Remember that consistency is more important than intensity. Even moderate, regular movement leads to measurable improvements in your vascular health over time. And here's the big cliffhanger as we move on. Even if you improve your brushing, diet, and circulation, there is one powerful thing that can undo all of your progress overnight, something that quietly speeds up the growth of bacteria while you sleep. In the next section, we'll talk about the nighttime habit that speeds up gum loss in seniors and how to protect yourself before you even lay down to sleep.
The nighttime habit that makes gum loss happen faster. What if the worst damage to your gums happens while you sleep instead of during the day? You brush, rinse, and think you've done everything right, but for 8 hours straight, your mouth could be the perfect place for bacteria to grow. This is especially concerning after age 60 because saliva production naturally slows down with age, and many common medications make it even less. According to the Mayo Clinic, dry mouth, also known as xerostomia, greatly raises the risk of gum disease, tooth decay, and tissue irritation. So let me ask you something important. Do you ever wake up with a dry, sticky feeling in your mouth? Saliva is more than just moisture. It's a biological defense system. It neutralizes acids, washes away food particles, controls bacterial populations, and delivers protective enzymes. Without enough saliva, harmful bacteria multiply quickly along the gum line. The American Dental Association says that saliva is very important for keeping the balance of microbes in the mouth. Think of it this way. If you turned off your home's cleaning system every night for 8 hours, debris would build up by morning. In your mouth, that debris is bacterial biofilm attaching directly at the gum margin, which is where recession starts. Now think about this carefully. Many older people take medications for allergies, depression, sleep, or blood pressure, and many of these medications list dry mouth as a side effect. Studies show that adults over 60 are much more likely to experience medication-induced xerostomia. This creates a silent vulnerability. You may be brushing perfectly, eating well, and even improving circulation, but if your mouth stays dry overnight, inflammation can quietly start up again each night. If you ignore this, it could ruin all your daytime efforts. Let's take a moment to look at the science. When you sleep, your saliva flow naturally slows down, even in healthy people. In people with dry mouth, the flow drops even more. This lets acid-producing bacteria grow. Acid irritates gum tissue and speeds up demineralization at exposed root surfaces. Research in geriatric dentistry shows that less saliva is strongly linked to deeper periodontal pockets and more sensitive gums. This means that dryness doesn't just make you uncomfortable, it also directly breaks down tissue. Take a moment to think about this. Do you sleep with your mouth open? Do you snore? Breathing through your mouth makes your mouth even drier at night. The airflow dries out your gums, making them less strong. If you wake up with cracked lips or a dry throat, that could mean that your gums are also drying out for hours at a time. Seniors should be aware of the risks of sleeping with their mouths open because prevention starts before sleep. So, what can you do? First, you need to drink enough water throughout the day. Many older people don't realize how much water they need because their thirst decreases with age. Drinking enough water helps your body make saliva. Second, think about ways to help your saliva flow. Xylitol-based lozenges or gums used earlier in the evening under dental guidance have been shown to reduce harmful bacteria and stimulate saliva flow. Clinical studies show that xylitol interferes with bacterial adhesion, lowering plaque formation over time. Imagine going to sleep with a cleaner, more balanced mouth. That change alone lowers inflammation. Don't use mouthwashes that contain alcohol before bed. Alcohol dries out tissues and can make dryness worse overnight. Instead, if you need to rinse with an antimicrobial solution, use one that doesn't contain alcohol. According to periodontal guidelines, alcohol-free rinses kill bacteria without drying out tissues. It's a small change that makes a big difference in protection. Another important factor is how much sugar you eat at night. Eating sweets, refined carbs, or even fruit snacks late at night feeds bacteria in your mouth right before your saliva production slows down. Imagine bacteria eating sugar while saliva flow is at its lowest. That environment speeds up acid production and gum irritation. Seniors should be careful about what they eat at night. Limiting sugar close to bedtime protects not only blood sugar levels, but also gum tissue health. Let's also talk about dentures and partial appliances. If you don't clean them well before bed, they can trap bacteria against your gums all night. Geriatric dental research always stresses the importance of taking out and cleaning dentures every night to avoid denture stomatitis, which is an inflammation. If you use oral appliances, this step is not optional. Now picture this other scenario. You drink enough water during the day. You don't use alcohol-based mouthwashes at night. You don't eat a lot of sugar late at night. You clean your mouth thoroughly but gently before bed. You naturally support saliva.
Over the course of months, the number of bacteria that grow at night goes down, inflammation goes down, your gums feel less sore, less reactive, and more stable. That's not a miracle, it's controlled biology. Many people don't realize that dry mouth affects more than just the gums. It also affects taste, digestion, and even how comfortable it is to speak. Energy levels after 60 are closely linked to how well you sleep and how much inflammation you have. When inflammation goes down, including in your mouth, systemic stress goes down too. Everything is connected. Take a moment to think about your nighttime routine. Is it set up to protect your gums, or does it leave them vulnerable every night? The best habits for seniors at home often start with small, consistent rituals before bed. Those last 5 minutes before you turn off the lights could be the difference between progress and stabilization. And here's a strong thought to end on before we move on to the final integration. Gum recession is rarely caused by just one thing. It is the result of inflammation, trauma, nutrient deficiency, poor circulation, and being vulnerable at night. When you treat all 5 layers at once, you create an environment where stabilization and, in some cases, partial regrowth becomes biologically possible. At the end, we'll put all of these ideas together into a clear plan of action. By the end of this video, you'll know exactly what to do starting today to keep your smile, your confidence, and your long-term health safe.
Professional help that helps regrowth. Even after learning how to brush, eat well, improve circulation, and protect your gums at night, some gum recession may need professional help to stop it from getting worse and to rebuild lost tissue. The previous strategies create the right biological environment for stabilization and partial recovery, but moderate to advanced recession often benefits from minimally invasive or clinical interventions. The key is to understand that acting quickly greatly improves outcomes. The American Academy of Periodontology says that the sooner gum problems are treated by a professional, the better the chances of preserving and regrowing tissue. The truth is that ignoring professional care can lead to permanent tissue loss and tooth instability. Scaling and root planing, also known as deep cleaning, is one of the most common treatments. This procedure removes hardened plaque and bacterial toxins below the gum line, smoothing the root surfaces so that gums can reattach more effectively. Research in geriatric populations shows that seniors who get regular scaling and root planing see big drops in pocket depth, inflammation, and bleeding within weeks. Picture the gums slowly settling back against a clean root surface, the foundation for natural repair. This procedure, along with the daily habits we've talked about, like gentle brushing, getting the right nutrients, improving circulation, and supporting saliva, boosts the body's natural ability to regrow. For more advanced recession, gum grafting procedures can restore tissue where natural repair is insufficient. Tissue is typically harvested from the palate or obtained from donor material, then carefully attached to the recession site. According to periodontal studies, over 90% of grafts in older adults integrate successfully when combined with proper home care. This not only improves aesthetics, but also protects exposed root surfaces from decay and sensitivity. The fascinating part is that the grafted tissue benefits from the same principles we've already covered: sufficient nutrients, reduced inflammation, and good circulation. Think of the graft as a seed. Your daily habits provide the fertile ground for it to thrive. Laser-assisted periodontal therapy is another new method that can target infected tissue and speed up healing while causing less damage. Clinical trials have shown that lasers can speed up tissue stabilization and lower the amount of bacteria, making them a useful addition to traditional mechanical treatments. Seniors who want less invasive options often respond well to this combination of technology and lifestyle support. Imagine a precise tool clearing the way for your gums to grow back while you keep up your daily anti-inflammatory and nutrient-rich routines. Platelet-rich fibrin therapy is a novel treatment that helps periodontal treatments heal faster. It uses parts of your own blood to help the gum tissue produce new cells, make collagen, and grow new blood vessels. Studies show that PRF can help grafts heal faster and better, especially in older people whose bodies repair more slowly on their own. This is a great illustration of how professional help and things you do at home work together. The clinic starts the mending, and your habits keep it going. Here's the most important thing to remember. Professional help works best when your body is ready for it. Even a graft or deep cleaning may not work if inflammation is out of control, nutrition is lacking, circulation is poor, or saliva is weak. This shows how important it is to see gum regrowth as a combination of lifestyle changes and medical help. Seniors who understand and use this two-pronged method generally see demonstrable improvements in gum attachment, less sensitivity, and even thicker tissue within a few months. Lastly, think about how it will affect you mentally and emotionally. Restoring gum health does more than only protect teeth. It also preserves confidence, makes eating comfortable again, and protects social interactions. Studies on the health of older people show that their dental health has a direct effect on their entire quality of life. You may keep your independence, energy, and long-term health by combining expert help with everyday habits that are based on science. Here's the cliffhanger before the end. These therapeutic approaches can change things, but they aren't magic. The true power comes from combining these treatments with the healthy practices we've talked about, like controlling inflammation, brushing technique, getting enough nutrients, improving circulation, and protecting yourself at sleep. If you miss one link, you can't move forward. If you embrace everyone, you can unlock the body's full ability to heal itself. There are no miracles involved in gum regrowth. It's all about biology. Lower inflammation, correct way to brush, make the most of nutrients, make blood flow better, keep saliva safe, put science and daily discipline together. That's how seniors can really live a healthy life that gives them power. Imagine yourself smiling with confidence at your grandkids. Think about eating without being sensitive. Think about keeping your real teeth till you're in your 80s and 90s. What you do today will affect that future. If this video was helpful, please subscribe today for additional information on elder health, morning routines for seniors, and science-backed ways to enhance energy after age 60. Like this video so that other older people can learn these habits that can change their lives. And watch the next video on your screen. What you learn next could preserve a lot more than just your smile.